morning, listeners and viewers. It's a wonderful day. It's a day of the Lord, and we continue to celebrate the joy of the resurrection. Death has been conquered, and we bless the Lord for his power to raise all of us up and invite us to continue to look at the risen Lord, who is the one who leads us in our faith. We welcome all of you this morning to this very special program. It is special because it is a gift that is being given to our people. As you know, the synod has been on and the people have spoken in various ways, and the church is seeking in all its ways to reach the people of God in different forms as their needs arise. So this morning we have two very special sisters, I would describe them, because they are members of the church. The chairman of the Diocesan Pastoral Council, that's Miss Glennis Roberts. She also is a parishioner of Blessed Sacrament in Grandance. And we have Dr. Marcia Rennie, who is also the Assistant Secretary of the Diocesan Pastoral Council and has a very integral role in what we are going to be speaking about this morning. You may have heard about it. It's outreach, it's a health fair, and so we have the two capable sisters to be able to share with us as to what can be expected. In fact, what gave rise to this health fair. Many people are having health fair, but in the concept of the Catholic understanding, I think you are looking to me more on a holistic path. I think you mentioned in the beginning, which was very interesting, you want to speak about it as wellness. More than just a health fair. Yes. So we have the chairperson of the Diocesan Pastoral Council, Ms. Glennis Roberts, and she will share with us on this initiative for this health fair, which they have coined into Outreach 2024. So welcome, and we invite you to share.
Thank you very much for having me. Thanks very much, Dwayne, for facilitating us. Welcome, Dr. Wren, even if we're far away in St. Andrew. And thank you for the listening public who are here with us. This stemmed from the synod, really. Once we got into office, part of what was said is that we need to accomplish what the synod said, which is what the people agreed to.
Okay.
And when we met, I think it was in Convent in September 2023, we identified outreach and Catholic education as part of what is important. So a committee was formed, and that committee came up with ideas of what we should do. It was chaired by Shoma Charles. And I don't want to forget names, but that committee, they know themselves, and we want to thank them because it was quite a number of committees set up, and this outreach was the only one that responded within the deadline. Now, the church recognized that we needed to go back to meeting people. So from that outreach, we came up with what can we do to start off. And the idea came of this health but well-being fair. Because it's looking at different things, because one of the pet of the bishop is that of mental health. Mental health is that fine line. But it's not only mental health, but people's emotional health, their spiritual health, their medical health, physical, social. We all have different aspects that bother us in some way or the other. So hence the reason we coined it that way. And we thought of going to the big parish first. Because truth be told, everything starts in St. George's. That's not Grenada. Grenada comprises of a lot of us. So we start in Big Parish, and that's for the Grenville car park. And I also want to introduce our executive, who many people may not know who are on the executive, but the Diocesan Pastoral Council is made up of all persons who chair their parish councils and the finance committee, including the organizations of the church, meaning Caritas, SVP, and all the other organizations that the church is so widely covering. And so we had an election last year, April, in Grenville, and the executive, we have Father Kufre is on the executive, as well as Vicar General Carl Hayes, the bishop, Dr. Wren, who is the assistant secretary, Joe May from Tivoli, who is the secretary, Mr. Pear from Croshu, who is the deputy chair, and myself.
Okay.
I said it in proper English.
Okay.
Start putting yourself last. Yes. So that's who we are, and we are trying our best to do outreach to the church, to get people back into the pews in a different form. It's like evangelization in a different form, so that we're going to go out to Grenville we said from 8 to 2, but setup will be from 7. We transform the car park. We're also looking at dental. I think the sickle cell will be there too, but all of those Dr. Wren will explain. However, we also have on board with us Carib Brewery. They are launching a new product, which is Stamol Ginger, so they'll be doing tasting as well at the car park. So we're looking forward to getting persons back, and as was said earlier by Dwayne, this is the first in a series of these fairs, well-being fairs that we're going to have, but we started that way.
Okay.
Since
Okay.
Eastern side.
Okay. So, listeners and viewers, you heard from the chairman of the Diocesan Pastoral Council. In case you're wondering, what is that? Well, it is the umbrella body that looks after the affairs of the church. And as she said, it is represented by various organizations and movements in the church and various persons who are members of the parish councils and the finance committee. So it's a big body, and of that body, there are various committees. And one of the committees, as we said, looked at the whole question of what can we do to reach the people. And this committee seemed to be the faster working one and came up with the outreach. We also like to let you know that Dr. Marcia is joining us Zoom from Grenville, and so she will be also a part of the conversation this morning on the well-being fair or wellness fair, but I want to stay with your theme, which is Outreach 2024. Okay, so when you hear Outreach 2024, it is focused on well-being, health, okay, in all of its fairs, if you want to look at it that way,
true.
Social, physical, because the Catholic Church doesn't just have a fair.
No.
We just doesn't do this because we think of the whole man.
Whole man.
And the whole thrust of evangelization is not an option.
True.
We are invited to evangelize, and this comes through serving Christ in each other.
True.
Okay, so it's a deeper meaning than just coming to get your blood pressure, coming to this.
True.
The whole atmosphere should present to the people a difference,
softness,
something that says there's something different here.
An experience.
Okay? An experience, yes. So, Dr. Massey, I know you have a very important role from, I heard big parish mentioned. I said, you better be careful with these terms. but Grenville, that's going to be the starting point, and I know you're one of the main organizers there for the health fair. How are things going so far?
Well, first of all, thank you for the opportunity for being on this program this morning. And I think it was a long-awaited one. And when we look at our church, before I answer your question directly, and when we look at the church as mother, she has always looked after the well-being of her children. And every one of us can attest to the fact that the church has built schools to educate its children, homes to look after its aged. The church, through various organizations, has looked after the physical well-being of its people, through Caritas, through Vincent de Paul. And the church has hospitals. Unfortunately, we don't have hospital in Grenada built by the church, but in other countries, the church has hospitals. So the church is really up to date with looking after the well-being of its people. And as a result of the synod listening, and that's one of the areas that the Lord is asking us in Grenada to look into, not just the physical, not just the educational and the spiritual, but the church, the Lord wants us to reach out to the well-being of its children. And since we can't build hospitals, one of the ways that we can do it is through the health fairs, so that as we go out through the country, as our sister rightfully said, this is just the first of a series. And as we go out, we can meet people where they are at. We must say that over the past years, we have seen, and the statistic has shown that there has been a rise in diabetes in the nation, hypertension, heart failures, and even sickle cell, a lot of other diseases. And it all boils down that if our persons are more enlightened as to what can minimize the incidence of these illnesses, I think that they would do much better and have a better quality of life. And this is the thrust of this outreach, to meet people where they're at, to inform them of the importance of certain health practices. I don't want to let out the cat from the bag, so I'm not going to talk about it now. But to inform them of health practices that will give them a better quality of life. And to also check out their vitals, where they are at, so that if they have not yet started, they can start to look after themselves. Presently, I must say that we are well on the way to do that. We would have with us members of the clergy who would be present for counseling, for confession, whatever is needed. Some people might just need to talk to a priest. Some of our priests would be there for that purpose, because we know that spiritual health and emotional health is a very important aspect of our well-being. And we would have Dr. Kins Douglas and her team with us, and they are going to look into mental health. And maybe the persons who really need the attention may not be there, but as parents, as friend, as relative, we may know someone who have mental issues, or maybe are just beginning to show signs, or maybe you have not even identified the signs in your children or in your neighbors. But as Dr. Kins Douglas, when she comes to that health fair, she would really bring light to that situation, so that persons would be able to identify around them, in our surroundings, our need to take further steps to ensure good mental health of persons within our reach. So we are hoping that people are going to take advantage of this opportunity and come out in large numbers to meet with Dr. Kins Douglas and her team, so that we would be able to really help our society to be more stable and less sick.
Yes.
We would also have the Red Cross with us, because I always believe that many incidents that occur don't have to end up in death, nor does it have to end up in serious complication if we would take the first steps to prevent it. So we're hoping to have the Red Cross and have emergency doctors with us who would help us, right, to recognize what we need to do in cases of emergency. Somebody might get burned, somebody might be drowning, somebody might get a cut, and the emergency doctors, together with the Red Cross, would walk with us along that way to inform us as to what we need to do to prevent further complication. We would also have persons dealing with men's health, and all of us know, I have brothers and I had a father, I have a husband, and men are afraid to get sick, and men are afraid to be told that they are sick.
Some men.
We want to use this opportunity, and we have male doctors for that. So we expect the men to come out in large numbers, because the male doctors, it would be man speaking to man, and getting to know your body, getting to know the changes that occur and where it is leading and how you can prevent it. So we would have male doctors on the scene just to help our men in those areas. And ladies, if you feel you want to go and listen, in case you have a son or a husband that you need to talk to, feel free. We would also have women's health. We would have, we are hoping to have the police officer, because we have to talk about social health, which is very important as it relates to not only drug abuse, but even beginning, because a lot of our persons in society, before it reached the point of drug abuse, they take a taste and they tell themselves that they could overcome it. They're bigger than that. It would not knock them down. And that's
okay, Marcy. I get what you're saying, that this health fair promises to be a different health fair, and you have collaborated with quite a number of doctors and other stakeholders, persons who have an interest in various aspects of health that will be there at that health fair. You heard what, yes, and ask you to just add to what
right. One of the things we're trying to do as well is to do forms, meaning take details.
Okay.
So, for example, you may be from St. Patrick and you came to Grenville and you stop at the fair. We take your information, then we can send it back to your parish to help track that person. So in the event that the person have an eye problem, that we can help them to go through the different stages to ensure that they get that remedy done. Because sometimes you go to health fair and that's the end of that.
Okay.
We want to be able to track people, and we want to use the young people for that, so that we get the young people to take the stats as you go through the various tents. So that form is being prepared. And for persons listening there, I find recently, Rutina, that we've taken a kind of back seat in terms of, let's say, helping and assisting, because something has given us, somebody fret us. Let's keep on the course. The Lord said, serve me. Next most important, love your neighbor as yourself. We have to learn to throw things behind us. What we are doing is trying to find persons within the church network that can contribute to helping humanity. That's where we're heading. Helping through humanity and evangelizing in the process. We do it with respect. We are not forcing, but we are respecting whatever people says. We are not,
So that brings us to the point of the confidentiality in what is going to be happening.
Yes.
I mean, you do not violate, you will ask, the person would agree or not agree.
True.
And you maintain that.
We maintain that.
Okay? So it's important for us to understand. Now, you talk about the different booths. Are you going to be having different times, or they all will be available and you have to go to any booth at any time? Would that be what is expected, or you have different times? Because you're starting from 8. I think it's 8 to 1 or 8 to 2.
Right, but we have to remember that everybody wouldn't come with the same need.
Okay.
So you'll have let's say, the dental booth. So somebody will come to want to go to the dental. So
I was going to ask if we're not having the dental
yeah,
booth.
we having dental, but she's a slipper, so I'm putting it in for her. So
we like to smile.
So we'll have persons in all the different sections taking the data. Okay, and if you're passing around, you'll say, okay, after that I want to go to prostrate. I want to go to sickle cell. So that form will go with you. Okay. So at the end, we can collate all and then be able to help out to track people.
Okay, okay.
Because I think tracking is what will make the difference. And to know that if this fair was, or well-being fair was effective, is how we can tell our success story.
And follow up, yes.
And follow up. And one of the things, you know, like in Grenada, we don't do is research. And how can we, from that data, know that it has been effective is something that we could continue year after year after year.
Okay.
Yeah.
Right. So it just wouldn't end there.
No.
You know, you would have to follow up. Someone is saying, happy to know that tracking will be done. That is definitely needed. Okay?
Good. Yes.
So we seem to be on point.
We seem to be on
right?
point. Thank you for
Yes.
that comment. Yes.
So it's important because people would like to, as you
Yes.
said,
we
know
need
what's
to track
happening.
and know what's happening. Yes.
With you, yes.
Yes.
So is there anything else, as listeners and viewers, in case you've just joined us, we are here with Ms. Glennis Roberts. She is the chairman of the Diocesan Pastoral Council, and Dr. Marcia, who is joining us, who is with us online, and she is mainly organizing for that zone, okay, of
Yes.
Grenville. Now tell us the zone. What other parishes or communities that make up that zone? When you say Grenville, how far are we extending? Because I understand that you are moving at different points.
So we're doing it according to how the diocese is broken up.
Okay, so the deaneries then.
Deaneries.
Okay.
Well, we said zone.
Zone, okay.
But it's different words.
When we are doing it on a deanery level, for example, St. David's people come up to Grenville on Saturday morning to make their groceries. They can feel free to come to the health fair.
Yes, okay.
Yes, it doesn't matter which part of Grenada you're from. Yes, we are dealing with it's not Eastern Deanery, but if you are on the spot, health fair is going on, you want to know,
You can check.
come in.
Yes, okay. That's good to know. That's good to know.
But as I said before, we want to
Yes.
That side rather than the normal.
Okay.
Because, you know, truth be told, St. George's get a lot of things all the time.
Okay, but
So
everybody will be served.
Everybody will be served because
Okay.
we go to the western
Right,
side.
so you're starting from that
That's-
point. But
yes.
the listeners, it's very important for you to note that this is going to be organized on a deanery level, but most people from St. David's and Tete's would come to Grenville and so.
Yes.
But even from St. George's, if you happen to be there, you can go to the health fair. But it's going to come to your area at some
Sometime.
point. Okay?
Yeah, but, you know, like...
It's good to know that.
And, you know, with health, you never know what could happen.
A stitch in time.
A stitch in time saves nine. And what I also want to encourage is persons out there who are listening and would be hearing. If there's any way you can help or give us suggestion, we are welcome to that as well.
How are they going to get the information to you? At a contact?
Yes. Yes, my cell phone number or home number is 444-1813. The cell is 405-1813. No coincidence. It was designed so that the children would remember cell, because remember when cell came in a long time ago, I had baby children. So that's why it was designed that way. And Dr. Wren will give hers as well. And they can also give messages to you, which you can pass to us. It's not like it's exclusive. And persons out there who are in the health field or in whatever area that you figure you can help the church, we need your help.
So you still are inviting persons?
We still are inviting persons, if it's not for this time, but for the other time, so that we know, like, when you're coming the western side, I'm available. I have this person that's available. In actual fact, we trying to do the test that when you do your blood, you can get, help me, Dr. Wren,
We'll be doing the blood sugar
cholesterol and
cholesterol test.
Okay. Diabetes, okay.
HB test, your hemoglobin test. We would also be taking person's weight, blood pressure. So we would be doing a number of exercises. And maybe a lot of us walking around not knowing that we are hypotensive or have high cholesterol. On that day, you have an opportunity to check yourself and know.
Would you be able to get the result of the cholesterol test there and then?
Yes, immediately.
Costing for that is about $2,000 EC. So anybody listening there who can help us with that, we are happy.
Because you do have a cost.
We do have a
attached
cost.
to it.
Yes, there's certain things we are trying to not, but some things you'll have to. And I want to thank everyone for rallying and doing what they need to do, because what we did was, break up responsibilities. So the cathedral has a responsibility, that parish, Blessed Sacrament has, different parishes have what they are taking care of. The Tivoli and Grenville, they are doing logistics. Okay. So it's a lot we are all coming together to do, and we want to thank everyone for helping out. But that's what the Catholic Church is about. We always stretching a hand.
Mm-hmm. Someone says here, good morning to you.
Morning.
It's Dale Blackman, and you probably know her. Says, good to see you. Good seeing you, Mrs. Victor. I saw the promotion on Facebook, and thought this was a very nice idea.
Thank you.
Okay? It's Dale Blackman.
We went to school together.
Oh, okay.
I think.
Hi, Dale.
Hi, Dale.
Okay. So people are, but you still need to, apart from that, apart from it being on Facebook and not everybody's there, we do this promotion today. What other means are you using to make sure that people know that this is on?
What we did is that we have it in the parishes every Sunday, as an announcement in church.
One of you, somebody's responsible to make sure they give the extra encouragement, or
the
just
secretary.
a dry...
No. The secretary. The secretary. We send to all the churches, especially those in that side, so that we encourage persons to. And truth be told, your best advertisement is face to face and telling people, calling on the phone, say, listen. So all of you who have heard this today, make it an opportunity to tell someone, so that we can have a successful fair. And I believe it will be, because, truth be told, Rutina and Dr. Wren, if we get 10 people, it's 10 people we didn't have. Okay. So that's the way I look at life all the time. So we are going to, and we are going to push and ensure that persons come. Because one of the things we wanted to guard against is doing a big blast so that you think it's a nationwide rather than zonal.
Okay.
So it's kind of dicey.
Mm-hmm.
That's why for the last week, we have to see how much we can push. Mm-hmm. So Dr. Wren, you may have to go with your loudspeaker through the
But because you also want to invite persons who are not necessarily
Catholics.
They don't have to
it's
be
everybody.
Whoever, because all of us share this concern.
Yes, it's not just for our fraternity, but for everyone.
Okay.
That's an important point.
Yes.
That we have to ensure.
Okay, great. So it is health and wellness.
Yes.
Everybody speak about well-being and wellness, and so, but you stress the holistic aspect.
Yeah.
The priest will be available, and all the baptized who are serving also bear witness.
Yes.
To the resurrection, or the goodness of God, the way we treat others, the way we listen to them, all of that will be expressions of evangelization.
True, and also we are collaborating too with different persons. As said before, we have Cara Brewery who will be doing the tasting of a new product, which is Star Malt Ginger. They'll be with us as well to do that. But we also have the police who do the physical fitness.
Okay.
They will be also part of this.
You have enough space for this there?
Well, Dr. Wren, I am not from Grenville, but they said Grenville car park is it. So we are hoping that it happens. Okay. Yeah, they say it's big enough. Okay. Because, they have, big, they had independent stuff there.
Okay.
They do.
Okay.
So we trust.
Okay.
If not, we just take a spot.
But it's a Grenville car park.
It's a Grenville car park.
That's where the action will be.
All roads lead.
And this is on Saturday the 20th.
April 20th,
So that's in the next
weekend.
Days,
yes.
Next weekend.
Yes.
At Saturday the 20th of April, 2024, from 8, you said 2. Is it 8 to 2 or 8 to 1?
I said 2 for safety.
Okay. So, but let us give the people, because if they come at 2 and you're packing up at 1 o'clock, that won't be nice.
So let Dr. Rennie tell the right time.
Let's give us a specific time so that the people can know when they can access the services there.
8 to 1.
8 to 1, okay? 8 to 1 p.m. That's at the Grenville car park on Saturday, April 20th, okay?
be there.
As you heard, there'll be quite a number of health booths, and it serves the whole person. So for the spiritual, mental, psychological, social, so many, okay? And you can get your blood pressure and all of that. You know, one of the things I find with these health fairs at times, people come there so anxious, and then you check the pressure is
gone,
high.
Very high.
And it's like, excuse me. So you got to take it again.
You got to take it again, yes.
You know, when the person
Relax.
calms down, because sometimes it shows really high because you're anxious.
Yes.
So all of these things, I guess, in communicating with the persons who come, you can help them to calm down.
To calm
and
themselves,
to be able to receive whatever it is.
So feel free, yes. And I expect to see you up there.
Well,
can you come up to help us?
As you said to me, my zone is not really up there, but
no, your zone bordering. Remember, both of us from St. David's. I know the boundary.
Okay, Minister. Laughing and humor is part of health.
I'm telling you.
It's very important for us to be able to smile.
And laugh and take something.
Some humor.
Take a light moment.
Yes.
Light moment.
Okay?
Yes.
So, listeners and viewers, we're going to give you a chance if there's anything you want to say to wrap up, anything we may have missed, anything you want the public to know. Think well so that you can give a final promotion. And the contact numbers, slowly you'll let us know if people want to help in whatever way to serve, what numbers they can contact you. Okay? So, Doc, is there any final word that you'd like to say to those who are listening and viewing, the whole importance of this and why they should come? What's on your heart that you'd like to leave them with?
Well, if we have the health fair and we have all the booths, and all the doctors and all the nurses, and the people don't turn out, it wouldn't be a health fair. So we expect persons to come out. All of us need to improve our health in one way or the other. All of us need to ensure measures to have a better quality of life. We're not getting younger, we're getting older, every one of us. And we need to find out what are the best ways that we can improve the quality of our life or stabilize it or ensure that we do not end up in bad quality health where we have to be hospitalized or even lose part of our bodies because of carelessness. We want you to know Mother Church cares. We care. We care about you physically, spiritually, and mentally in every sense. And this is just an opportunity for you to open your heart and your life and receive the care and the love that Mother Church is giving to you. Come out one, come all. We expect to see you there.
You know what crossed my mind? Health is a very expensive.
You know, and many people they have an initial problem of the mental anguish should something happen to them.
True.
And then they don't have the means of paying their way through.
Yes.
You know, all of these things have to be considered, that people really do need help to be able to pursue
move to the next
level. And so I'm glad you said that, but at the beginning and all of that, these are ways that the church has helped and continue to help, right?
Yes.
But we need to go a bit deeper. In our own space.
Finding. And there are a lot of people out there who wouldn't mind helping, but they do not know.
Right.
And a lot of times we struggle with things because of this called pride. And I do not know why when persons are ailing for some reason, it's a top secret. This is sad because you should be able to chat with somebody at least. So, people, I think, out of the box sometimes. And I said, to myself, because, when you look at, because we always think, humans, we always think the worst from the onset. Mm-hmm. If something happens, you always think, I will die sooner. But we have to die anyway. So we all have to die. There's 6 million ways to die, but as Dr. Rennie say, if we take care of ourselves, and you too, Rutina, it gives us a better way of living. And sometimes if people know better in terms of their diet, because I think that's one of the things we missed as well, we should be having nutritionists on board as well to help people, guide them through, even with literature. That's one of the things we're aiming for as well. One of the things that concerns me, though, is that of the elderly. So if we know any elderly persons, that's people who coming to the fair, that know elderly persons who are at home alone, do not have that means of, that's another angle the church can use to go to get them to get to them, to not only come, but to just attend to them nicely and respectfully, because that's the least we can do for them at age, because we still have a lot of people in their 90s who are trapped alone. So that's one of my concerns, is that the way people live. I mean, I think, Rutina and Dr. Rennie, there's enough wealth in the world that everybody can live comfortably. But somehow, the poor is always with us. But we need to continue to focus on how can we help them in their state to have a better way of life.
I take this. Yes.
Yeah.
Because I really like the point you made, that apart from the health fair, it should lead us to be more community-oriented.
Yes.
Visiting people, because lots of people are alone.
I'm telling you.
And they need help, maybe just sometimes even to go, and they have the money to get their medication and different
just
things.
To talk to.
Apart from that, I think your tracking or the follow-up could be persons who have identified persons in their community who need that kind of help and could offer that assistance. So this is a beginning of something that could be, really, really beneficial and profitable to the nation.
Yes.
And as I said, the person who does it, in fact, you're the first one to receive the great benefit, really. The one who actually serves.
True.
So
that's that self-satisfaction.
Yes. So we encourage you to keep on keeping on. Our faith drives us to do this. It's not just like we are just doing this because it's a good thing to do, but the faith should drive us to do all these things. And also the kind of work that I ask you to do is a work that is filled with my spirit.
Yes.
So you do it with the heart of Jesus, and we serve Jesus and the persons who are coming to us.
True.
That's what makes the difference,
Yes.
So we really pray that the Lord will go ahead of us,
yes.
In these health fair and this wellness fair, so that people can really receive something, something that can help them feel better, at the end of that. So just to recap, it is, I wanted Outreach 2024.
Yes.
Outreach 2024. That's the sign you would see. It's on Saturday, the 20th of April, 2024, from 8 to 1 p.m. at the Grenville car park. Many persons will be there, many health professionals, and you might be surprised, really. You might really be surprised. I think you kept some of the surprises there, but you have let out quite a lot, so please, you will not be disappointed. We encourage you to be open, to take advantage of this gift that we are receiving from the church, okay? Yeah. And we thank you and the committee for deciding to go on with this wellness. Remember the numbers to contact, because there's still help. You asking for help. It could be financial and otherwise, and persons with skills and talents who can offer.
Dr. Ramsey.
Please call Ms. Glennis Roberts on 444-1813, 405-1813. Dr. Rennie, can we have your contact?
457-0141.
Yes.
And you can also get me at the office, 442-4001. After hours, you can get me at home, 442-7271.
That's a bit of contacts, okay? So listeners and viewers, again, you can help is needed in various ways. You can contact Ms. Glennis Roberts, the chairman of the Diocesan Pastoral Council. Just to give you her contact, 444-1813, 405-1813, and Dr. Marcia, 457-0141, 442-4001. and at home 442-7271. You must catch one of these numbers.
Must catch on.
Okay, so we thank you all for joining us just for this promotion on the Outreach 2024. It is a health fair, wellness fair, and it is going to start at the Grenville car park.
And we'll be back to give you the results.
Okay,
Back here.
the result.
We come to discuss how it was
Okay,
and
great.
what we need to do better for the other one.
Okay, great.
Because we
So-
need the listeners to know.
Right. So you do not know where you'll be going after Grenville? You have not
We
decided
have not
where?
decided as
Okay,
yet.
Okay. So you
But
will know
it
in
will be
time.
west or south.
Okay, okay. But you will
Either
decide.
one.
You will
We
let us
decide,
know.
yes.
Okay? But for this, the Saturday the 20th, we're going to be meeting at the Grenville car park from 8 to 1 p.m. for Outreach 2024, our health and wellness fair. We thanked the chairman, Ms. Glennis Roberts, and Dr. Marcia for taking the time off to be here to invite persons to be part of this experience. I've been your host, Ruthina Victor. Thank you for listening, and we'll see you again after the health fair with
Bye.
our friends to tell us how it has been.